So the role of mixed insulin, if given the morning time, to control the evening insulin, and the evening dose before the dinner is to control the morning insulin. So if any case, if you're during the day blood sugar is high, you increase the morning insulin. So you have to go backward. Similarly, if your fasting blood sugar is high, you need to increase the nighttime insulin. As it's combination insulin, so sometimes you can get into the trap that you might have low sugars post meal and your evening sugars levels are high, your fasting sugars are high. So in that case, you do not titrate the insulin. But most people will be able to adjust your insulin based on your evening blood sugars. You increase the morning insulin. If it's morning fasting blood sugar is high, you increase the night insulin. So this usually, it should be titrated every third to fifth day of adjusting the blood sugars rather than doing it on a daily basis. And it's very important to be aware of hypoglycemia and look around the video of the hypoglycemia, because any insulin given at any dose, you can have any hypoglycemia. It depends upon how much insulin, how much you've eaten, your exercise level, and your other status of your body as well. What we call is a basal-bolus injection, so multiple injections. So what we give, with each meal, we give you a rapid-acting insulin, the breakfast, lunch, and dinner. And we give a long-acting insulin traditionally given either glargine, detamere, or deglutec given at bedtime, or you can also take it in the morning time. But the timing of the long-acting is important. But as far as the meal-based insulin, the rapid-acting insulin should be given within 5 minutes of taking meal. So you should have a meal ready before you inject. So as traditionally, we take 3 meals a day, we inject 3 meals a day. Now, for example, if we decide to give you, say example, 10 units of any rapid-acting insulin like Novorapid, Atripra, or Humalog, we control the post-meal blood sugar levels. And if, for example, if your post-meal blood sugar is still going above 200 or 180, you can increase the breakfast insulin. And in case if you're giving 10 units at lunch as well, and your post-lunch is going down, you can cut down from 10 to 8 units of insulin. So we can regulate the insulin. If the post-breakfast is high, we can increase the breakfast insulin. If your post-lunch is low, you can cut down your lunch insulin. Similarly, if your dinner blood sugar levels are fine with the 10 units of insulin, we carry on with the 10 units of insulin. So based on your fasting sugar, we adjust the long-acting insulin. The long-acting insulin works entirely mainly on the fasting blood sugars. If your fasting levels are higher than 100 or 120, you can increase your long-acting insulin by 2 to 4 units. So the long-acting insulin is usually controls the fasting blood sugar levels, the baseline blood sugars. The rapid-acting controls the post-meal blood sugars. So we'll have two different type of pens, which one would control the post-meal blood sugars, and the one will control the fasting blood sugars levels. And it's very important to adjust your blood sugars every 3 to 5 days. There's always a risk of hypoglycemia happening with any type of insulin. If it's happening anytime, you need to really look at why it's happening, at what time it's happening. If your blood sugar is going low at, say, midnight, then you have the dinner insulin is the culprit. You might feel it is a long-acting insulin, the Lantus or Levemir or Tresiba at fault, but mostly it is the nighttime insulin. We tend to not to target very heavy on the nighttime insulin because we don't want nighttime hypoglycemia or anytime hypoglycemia. So it's very important to go back. So if you're having blood sugars going up to 2 to 3 a.m., that could be the culprit, and cut down the dinner insulin. If your blood sugar is low at around 11 after post-breakfast, this could be the breakfast insulin. So you have to go backward to make sure what sort of insulin you have to adjust to avoid any hypoglycemia. Similarly, increase the insulin if the blood sugar levels are high. It's very straightforward, 1 long-acting insulin and 3 rapid-acting insulin with each meal, because the duration of actions determines at what sort of pattern of blood sugar it will control by injecting before the meals. So it's very important to carry on adjusting insulin, and once you find that an X amount of insulin with each meal and a long-acting insulin is adjusting your blood sugars, it's very important to continue the same dose rather than trying to cut down. So most people try to think that, look, once my blood sugar is fine, I can cut down my insulin dose. That's completely incorrect. You have to take insulin according to what's your blood sugar control at what sort of doses of insulin you have been taking. So it's very important to continue. If his sugar is going high, then you have to increase the insulin according to what type of pattern it is showing, and obviously if it's running low, you have to cut down your insulin. And in case if you're taking less than your regular meal pattern, less than your normal breakfast, you can always cut down your breakfast by 20 to 40%. So this is like a very flexible insulin regime.